Today I'm going to be doing my 35 and 36 week pregnancy update. Just put those 2 weeks together. Actually, a lot has changed in these 2 weeks. Some are kind of scary, involving preeclampsia. So first I'm going to start with the symptoms and all that, then I'll get into my actual what's going on with me personally. So it says in week 35 it says the baby's the size of a squash. And in week 36, it says the baby's the size of a bunch of kale, measuring 18 to 19 inches long and 6 pounds. So I actually did end up getting a 3D ultrasound, so I'll insert some of those pictures in. And he weighed 6 pounds, 3 ounces, and that was about a week ago. That was at 35 weeks when I got that. And now I am 36 weeks and 4 days, so I'm sure he weighs more than that. It says now baby has pink skin and is starting to get chubbier and chubbier every day, as in like packing on fat. So if he was born now, they would just look like a normal baby. Hearing is getting better. They say the baby can actually recognize your voice now, and then after it's born, it can recognize songs and voices that it heard in the womb. Baby may have dropped into the birth canal by now, as in when people say they dropped. And I don't know, I'm not really good at that. I don't think I have. To me, I'm just getting bigger, and I don't think that I have dropped, really. It says the growing is starting to slow down because now you only have 4 weeks left or less. So the growing is starting to slow down. 36 weeks pregnant is how many months? Now this is a big thing people are always talking about, saying, oh, you're this many months or you're that or whatever. People say different stuff, but I just go off of, I'm just going to read off of what this says. It says, if you are 36 weeks, you are in month 9. So I'm in month 9 of my pregnancy. At 36 weeks, the baby's skull is not fused together yet because that gives it the room to fit through the birth canal during labor, and then it will go back, then it will go together obviously afterwards, but that's why, just so it can fit through the birth canal. Your body at 36 weeks pregnant, this is just some of the stuff that most people have at 36 weeks, some people do, some people don't, is the first one is a pregnancy waddle. So I would definitely say I do have that. Definitely after sitting down for a long period of time, then standing up, that's when I waddle the most. Pelvic pain. Yes, for me, definitely I have pelvic pain. If I'm laying on one side and I like try to roll over like in bed, like from my left to my right side, it's very painful, like very extremely painful. I never had that with my first, so this is the first time for me experiencing that. I was able to roll over with no problem with my first. So that is something that is new with this pregnancy, but is also very common. Baby drops. So by 36 weeks, like I said before, your baby may have dropped. You might be able to breathe better. They say that now if baby has dropped and is like heading into your birth canal, that it relieves pressure and you may be able to breathe better. For me, that is 100% not true yet, and I can't wait for that to be true because it's horrible. Like he likes to sit like all the way up here. It almost feels like he's stretching out up here, and I cannot breathe. Walking up the stairs, getting dressed, any typical daily activity, I cannot breathe. So hopefully that comes before I give birth, but we're almost there. So trouble sleeping. I don't really think I have trouble sleeping. Sometimes I'll wake up, obviously to go to the bathroom, or if I get a Braxton Hicks or something like that, but it's very rare. Like I don't see much of a difference in sleep scheduling from when I was pregnant to now, or from when I wasn't pregnant to now, I mean. Heartburn is one. Yes, I still have heartburn. I've had heartburn, I feel like 80% of this pregnancy. It's been absolutely horrible. At this point, Tums are not even helping anymore because you can only take, on my bottle it says 5 a day if you're pregnant, and I could take 500, I feel like, and it wouldn't work. But obviously I'm not going to take over what it says, and it doesn't work for me at all. So the only thing that really works is ice, like eating ice, and it only lasts a little bit. So swollen ankles and feet. So this is a new one for me. I definitely have noticed. Obviously, I was swollen before, but I have gotten very, very swollen recently in my hands and my feet, and I'll get into that in a little bit. Changes in vaginal discharge. I don't think there's much of a change for me. I know you can lose your mucus plug between now and before you give birth. I don't know if everyone loses it or not, because I did with my son, so I'm not sure, but I haven't yet. So I know changes can come. Obviously, if it's like a gush of water or something like that, then you should probably go to the hospital because it was most likely your water. So that's just the basic symptoms that people have when they're 36 weeks. So now the thing that is new for me is getting diagnosed with a preeclampsia at 36 weeks. So what happened was I started seeing floating dots almost. They were like black dots, and they're like all over my, like in my vision. So that was kind of concerning for me. And then I started getting super dizzy, like if I stood up or if I walked somewhere or something, like getting more dizzy than normal, like if you stand up too fast. Like if I were to walk from the table to the bathroom, I would almost have to sit down because I feel like I'm gonna pass out. Then I started feeling super sick to my stomach, vomiting, nauseous, and so I was like, okay, I feel like something isn't right. So I just contacted my OB, and he's like, yeah, you need to come in now. It's a sign of preeclampsia. So I went into my OB for a regular checkup, and he took my blood pressure, and my blood pressure was super high. I feel like it was like 158 over 90 something. So he was like concerned. So he sent me to the ER to get blood work done and to test my urine and to do all that stuff to test for preeclampsia. That's why he sent me there. So my blood work actually came back not bad. Like it's not like super high or what. I don't know what they test for. He said it wasn't super bad, but I did have a high amount of protein in my urine, and my blood pressure was still super high. And I was, another thing was having a really bad headache. And I was still having the headaches and the dizziness and the vision changes. So he was worried because obviously if you have preeclampsia, they induce you early because it can cause very bad health problems, and it's dangerous for the baby and the mom. So I'm only 36 weeks, so getting induced now would risk the baby going to intensive care because of his lung development, and we don't want that. So he is monitoring me super, super closely. I have to go to the doctor twice a week now, like Monday, Friday, until I am at least 37 weeks, and then he's going to induce me if the symptoms get worse or don't get better because he doesn't want to risk it. So I will be 37 weeks Friday, and I have an appointment Friday. So then he will discuss like the date for me to be induced or see how I'm feeling, and if I can make it to 38 weeks, then that's what our goal is, at least to 38 weeks. Obviously the best would be 40, but that is definitely not happening. He doesn't want to risk going that long at all. So 37 or 38 is his goal, and it's looking more towards 37 or maybe like a little bit after 37 because my symptoms are not getting better. The dizziness is getting worse, the vision is getting worse, my headaches come and go. So there's that so that was kind of scary. But some things to keep in mind at 36 weeks pregnant is to make a birth plan, which I already did. I don't know about everyone's OB, but mine, I just asked for a birth plan and they printed it off and handed it to me, and I just filled it out, and the questions on it. So they had questions on it, and obviously this is the birth plan for my specific hospital that I'm going to. I don't know if it's all the same or what. Okay, so at the top it just says my birth plan, and then asks for my name, my partner's name, my doctor, emergency contact, phone number, stuff like that. It says my preferences for labor and delivery. So this is where it says my support person, I put my husband, and it says my delivery is planned, and it says vaginal, C-section, or VBAC. So mine's vaginal. And then it asks you if you have taken childbirth education classes or breastfeeding classes. You put yes or no. It says to have my support person with me during labor and delivery. You check yes or no. For all these questions, you check either yes or no. To wear my own clothes, to walk and move freely, to take pictures during labor, to use a birthing ball. Now it says, for pain relief, I would like to, and again, it's just yes or no questions for these as well. Breathing, like breathing techniques that they show you. different positions, walking, massage, meditation, narcotics, epidural, and then it says, please do not offer me pain medicine unless I ask for it. So I put yes, so that way if I'm in pain, I don't want them constantly asking me if I want narcotics and stuff like that. I want to be able to just say it when I need it, which it's up to you. Doesn't make a difference. If you need it, do what you need to do to make yourself comfortable. It's your labor. During delivery, I would like to kneel/squat, be on my hands and knees, have help for leg support, use a birthing bar, and then ask if you want to touch the head as it crowns. Okay, and then after birth, I would like my partner to cut the umbilical cord, to hold my baby as soon as he or she is born, to wait to hold my baby until he or she has had its bath, to breastfeed right away. And then baby care, it says, my plans for feeding my baby are breast or bottle. If my baby's a boy, he'll be circumcised. It is okay to give my baby a pacifier. My baby will receive the hepatitis vaccine, and my baby will have a hearing screen. So obviously you select yes or no. And then stuff at the bottom for you to write in. It says, these are some things to help me with pain. And then the last one says, these things are also important to me. And I put delayed cord clamping, babies put on my chest after birth, my husband to stay in the room with me at all times, obviously unless something emergency happens and he has to go. I would like to have a room with a tub. Baby stays in the room with me at all times unless he's getting shots or something, hearing tests, etc. And then for people visiting, I put they must wash their hands before touching or holding baby, no excuses, and no kissing baby's face or hands. So that's just what I put. Obviously, you have to keep in mind that stuff changes with your birth plan. Things could go wrong, and you just have to keep that in mind that not everything might go exactly the way it's planned. So that, and then the last thing is sleep on your side. This is something my OB has discussed with me that I really didn't know why they always said to sleep on your left or your right side. The best is your left for the baby breathing. But they say sleeping on your back can actually cause an increased risk of a stillborn, which obviously no one wants that. That's absolutely horrible. So I sleep on my side anyways, so that wasn't actually an issue for me at all. But that is my 35 and 36 week update. I'm not sure if I'll do a 37 and 38. My next video might be labor and delivery. I'm not sure, but we will see. And I'm actually going to make a video. My next video will probably be what's in my hospital bag. And then after that, it's probably going to be labor and delivery. If not, then it will be another pregnancy update. But I will show you my bump. So here's my bump. 36 weeks, starting to get little stretch marks right there. And right there. So that is my bump. And I do have that line as well that they talk about. So that's it.